I just wanted to correct that, I think. Okay. Now, with the Canadian Medical Association, I have an understanding that, as you say, the medical science is that they're still developing brain tissue until 25, and you're recommending 21. Now, our concern is, as you're probably aware, that the greatest amount of highest proportion of use for populations is 18 to 24. Now, we've had a lot of discussion about this. Would you agree that there would be risk of significant harm simply to the 18 to 21 group if they were not able to buy it legally, would in fact go to the illegal market and have the be faced with the criminal sanctions as well as having to deal with the dangerous elements in the black market?
I could say most of them began before the age of 18, but at the age 18 to 24, they are already addicted to that. Mm-hmm. And it's why we have a great proportion at this age. Mm-hmm. And we still want to have this age at 21 and maybe 25, because the damage done to the brain will be permanent, and it's more than we think. We think it's a recreational drug, but this recreational drug make damage to the brain for the rest of the life of these people. So we have to protect them, and it's why we are so focused on this issue. And maybe Jeff has some other.
Thank you. It's a fair question, and I would say we're, of course, really focused primarily on the medical evidence and what that shows in terms of the effect of marijuana on the developing brain, and we understand the other sort of considerations, and that's why we sort of said, ideally 25 would be the right age, because brain development occurs up until that point. I would say we're, in many ways, very surprised that the medical evidence hasn't been taken into more account, and we recognize, maybe that's because we're medical professionals and that's our job. And so we recognize some of the competing priorities in balancing those risks. I would say from our perspective, based on what we've seen in clinic, what the evidence shows, we still think the right balance is 21, recognizing, as you say, that the competing risk would be having use go to other sources. We think it's a little bit easier to try and mitigate some of those things than it is to undo the harm potentially that occurs under the age of 21. So we continue to think that would be a good sort of common ground.
Yeah. No, I understand. And again, from the purely medical scientific perspective, I would actually be the first to agree. However, as you've said in your testimony, that they're already using it in high amounts now that it is illegal. It is already illegal, and they're not a lot of them are just not listening to the advice about it. So if you raise the age to 21, would you have any less youth usage of it? Would the people from 18 to 21 be using it any less if you put the legal age at 21 than they are right now when it's already illegal and they're using it a lot?
We hope they would.
And this recommendation doesn't come alone. It comes with a good education. When it will be legalized, it will be permitted to push a good educational state for the youth.
Sure.
So, and if they are really well aware at the age of 12, 13, 14, they will just be away from this maybe more. And if they decide at the age of 21 to take it, it will be their judgment, and the damage will be less. But if there are already damage in their brain at the age of 16, 17, and 18, 19, it will be for the life, and our doctors in Canada are just concerned about this damage. We see these people every day in our office, and we see how they are suffering of this, and they regret it. But because it is associated with addiction, they can leave it. So we have to support them when they want to leave this bad habit they taken.
Okay, thank you. How much time do I have left?
44 seconds.
Okay. And this is a quick question developed for our public safety colleagues. Now, one of the things we talk about in prohibition, we all know that the historical example of prohibition in the United States and how much criminal activity there was due to illegal alcohol and what happened to the landscape after that. I've heard some criticism of that analogy because it's 100 years old. that this happened. That being said, despite the passage of a century of time, do we have things to learn from that example in response to public safety and prohibition?
Thank you very much for the question, Chair. Just to the honorable member, I think we do, but keeping in mind it is 100 years difference, and we're dealing with different players and groups. I think what we're doing now is we're creating a regime with a legalized supply of cannabis, and so our sense is that we want to get that framework put into place. We want to have safe access to cannabis. We want to make sure that in terms of law enforcement, that we're actually going to have the ability to deter organized crime. And then 3, for some of the other issues around our youth that have just been discussed, I think that's important as well. So for us, it's important that we make sure that we have a lot of public awareness for youth around the system. I think that's probably a little bit different 100 years ago in terms of communications, but all that to say that I think it's very important that public awareness, number one, around the regime is important, and then law enforcement specifically has the capability and the ability to deal with organized crime in the black market to ensure that profits don't land in the hands of organized crime, largely because profits usually go to other areas of concern.
Thank you very much.
Time's up. Mr. Webb.